Once again, hello to everyone. Today I will be sharing a few points that you need to remember when you're writing an exam, whatever exam it may be. Whenever you write an exam, always write the value points. That's the only way any lazy exam writing student can study less and increase marks, score good. For that, value points, what all should be there in your answer is that don't study too much. Study only the points. Half of your time is saved and you can score marks too. Always write points only in the exam. I am telling this for students who are appearing for a medical exam or any medical background related exams, because writing part will be more for them. So, even in school levels also, in any types of exams, you can opt to this. Write in points only. Only write the relevant points. Don't write too much of it. It will be difficult for the examiner who is valuing your paper also. He won't patiently wait for your answer. He needs only the points. And always underline the main points, what you have to say. Main points. In pattern of writing a paragraph, when you're writing in a paragraph, do the same procedure. Underline the points of importance. So checking that he can score you marks. If diagrams, let it be related to anything, is there in your answer, you have to draw the diagram, because even if you cannot, this I'm telling in cases of students who are good at drawing, if they're unable to convey it through words, a diagram is more than enough to give you marks. Then, give headings wherever necessary. Don't just go on writing. At places, make it interesting. Give headings to your answers. Handwriting, the most important part. Have a good handwriting. It's always essential. A child who writes a lot with a bad handwriting is not a good student. And he is not a must that he gets answers correct. If your writing is good enough, it will help you to score more marks. The person who is reading your paper will also be delightful to read it. So handwriting is most important. Write main points at the top of your answer. If your answer is a long essay type of answer, always write the main points at the top of your answer. Then go down and write blunders. Also, it's not a problem. But in the beginning, if itself it is a blunder, you lose your marks, your impression is lost there. So main points at the top of your answer. Don't write things you're sure is wrong. If you know the thing is wrong, don't attempt to write it. Again, you lose your impression. The examiner won't look into the rest of your answer. Hence, you will lose your marks. Next is tips for medical students' exams. As far as I have written my exams, my teachers have said me, always write the, normally in our pattern of question paper, Indian students, we have is that we have an essay of 15 marks, then a 5-mark set of questions and a 2-mark set of questions. All this 5-mark and 2-mark set of questions are 10 each, and 15-mark question of 2 each. So if you're attempting 5-mark and 2-mark questions at the first, it will give you maximum marks. Then only go for the long answers. You will handle the time also, and you'll be able to score marks also. Next is method of study. How you should study. If it is a definition, you can recollect it by how, what and where. What it is, what is the reason of it, and what is the result of it. In that manner. Always definition is the mark that is scored more value point. Always at least study the important etiology. There will be a lot of etiology, causes for any kind of answers, causes for any diseases or anything like that. Always at least study 1 or 2 most important etiology. That's enough to score a mark rather than writing 10 or 15 of them. Always important terms. The terms which will be given, important terms that will be given in red or something in your textbooks, at least remember those terms. Again, they are value added points. Then in a normal disease, you are writing an answer to a question of a disease, you have to include, let it be in practice of medicine, in community medicine, or in pathology, or any subjects related to that. You have to always include an etiology, a pathology, a clinical feature, a diagnosis, and if differential diagnosis present, and treatment. These points must be included, and in this pattern, this will give you a clean answer outlook and will satisfy your examiner. Thank you so much for watching my video. And always, I have to say one thing, that always promote a person who helps you out. I have not seen yet any subscribers or any people who have liked my videos. I hope somebody is benefiting from it. So please do give me an encouragement.